Okay, I'm here today with Dr. Ashley Thusher. She's in the AT program here at Arkansas State. Okay, I'm just going to ask you a few questions. Is that all right?
All right.
Okay, so why did you choose this profession?
I chose this profession originally. I was looking more towards physical therapy, and when I got into my athletic training classes, I really liked them. And when I worked in a PT clinic, I decided I didn't like that, so that's why I decided to stick with athletic training, because I really liked being outside, working with the sports teams, providing patient care. I really liked that aspect of it.
Okay, so how long have you been working in this field?
I was certified in 2009, so I've been about 6.5 years is how long I've been certified.
And what advice would you give someone like pursuing an AT major and like working?
Well, I think it would depend on what your future goal is. So if you're asking for yourself personally, what's your future goal? Where do you want to be?
I'm an AT major right now, and I see myself like working in the field, and then possibly pursuing like a PA school possibly down the road.
So if you're working, it depends on the work setting that you would want to do. So for example, if you wanted to work in collegiate sports, my advice to you would be get as much experience as possible doing internships during the summer and getting involved with things like your AATA, NATA, SWATA, getting involved with professional organizations early on, because that'll give you a leg up when you're looking to apply to graduate school, because if you're wanting to work in the collegiate setting, you would need to get your master's degree. And so I'd say prepping for that, starting early to get involved with everything that you can do would be a good thing.
Okay, so what would you say like a typical day is for you?
For me, my day is very different than athletic trainers are practicing clinically, just because I am a professor.
Yeah.
And so my typical day depends on the day. Like when I have classes, Monday, Wednesday, Friday, I teach classes. So essentially, I come in, get prep, I prep for classes, teach the classes, and then on Tuesday, Thursday is more my office hours and research days. So on those days, I'm essentially in here spreading out all my stuff I have to do. If you see articles everywhere, spreading things out and doing some research. And then I also have grading and service activities. Like, for example, one of my service activities are reviewing articles for professional journals, and that's what I'm actually working on right now. So a day, it's not really a typical day, just because everything's kind of changes based on what I need to do.
So what would you say some of your responsibilities are?
My responsibilities, our job's kind of split into teaching, research, and service.
Okay.
So my responsibility is to teach the athletic training students and exercise science students in their classes and make sure that they are understanding what the concepts are and gaining competence, because for athletic training, you'll learn in next semester all the different competencies and the things that athletic training is involved in. So my job is to really make sure that they have that. And also, I serve as a clinical coordinator, so my job is also to make sure the clinical sites, I work with preceptors, make sure they do the preceptor evaluations, students are getting their hours that they need to get, everything's working out kind of okay with that we're getting new preceptor locations, etc. So that's kind of my role with the teaching part of it. With service and research, it's a little bit different, because with the research, I've been doing a lot of interviews and surveys recently. So right now I'm working on some data analysis and writing, and then service is just whatever needs to be done at that time.
Okay, so was it difficult to like find a job after college?
It was not difficult for me to find a job, but I think I was prepared very well through my graduate work. So it depends on where you go. Like as an athletic trainer, since I'm in a different part of it, since I'm in the education, not the practicing field, I think if you are looking for a job post-graduation, it can be easy to find a job if you're willing to move. Does that make sense?
Yeah.
Like if you're looking to stay like in one location, it might be a little more difficult depending on what's available. But if you look at the NATA Career Center, there are tons of openings there. So if you're willing to move, you can easily find a job.
Did you ever like want to work in the field?
I did work in the field when I first graduated, and I did that for a few years, and I did enjoy it, and I really like working clinically. But when I was looking at things like what I wanted to do with I didn't want to work like 80, 90 hours a week and have a coach dictate my schedule. So that's why, and I decided I wanted to go this route instead.
Do you find your job exciting or boring, and why?
Every job is going to be exciting and every job is going to be boring, depending on the days. I mean, I wouldn't call it boring per se, but there are days when it gets a little monotonous.
Okay,
and it's like, I just want to be done writing this research article. Can I just be done? But then there are days when it's really kind of exciting and fun, when you're doing fun stuff in class, or when people are starting to understand things a little bit better, or when you're actually doing the research and you're getting new information. I find that kind of exciting.
Yeah.
As far as like practicing clinically, which is probably what you're looking to do, there can be some very exciting days. Like I think my most exciting was when I had had a patient who had shock, and he went into shock, and so that was a very exciting thing.
Whoa.
And like relocating different joints, relocating, like I've relocated a shoulder, I've relocated some fingers, and just like that kind of stuff can get a little exciting.
Yeah.
Does it get monotonous when you're sitting there and there's nothing going on, or you're doing your 50 millionth ultrasound? It can get a little monotonous,
Gotcha.
but it can also be very exciting when you're finding new treatment techniques and stuff.
Okay, last question. What would you say, like, whenever you worked in the field, like the worst injury that you saw or had to deal with?
The worst thing was probably a kid that had shock.
Yeah.
Just because it was so crazy, and it's one of the shock is one of those things you don't see it much, but when you do, you kind of know it.
Yeah.
Because of how it was happening, like his organs were essentially shutting down. Like he couldn't feel his legs. He was freezing. His heart rate had slowed down so much. His blood pressure was very low. His pulse rate was very rapid, but it was very weak. I mean, you could kind of tell what was going on. So that was probably the worst that I had ever seen, because it was just one of those, it was like, okay, I just need to settle and handle this, because everybody's sitting there thinking, what's going on with this kid? And I'm like, all right, let's handle this. So you gotta kind of calm yourself down and handle it. And like,
I'm sure that's kind of hard. It's very, like, if I saw someone in shock,
I mean, that's one of those things, you kind of, your education, your knowledge, and your everything kind of
has to come into play.
Yeah, it's like, yes, it can be really kind of scary the first time, because you're sitting here thinking like, or like, for instance, there are some new athletic trainers who have to signboard people, and that can be pretty scary the first time, or if you come up to somebody who's unconscious for the first time, that can be pretty scary, but you just have to sit there and be like, okay, I am the medical professional, I need to calm down, I need to do what I am trained to do, so that this person either lives, if it's a life or death situation, like being unconscious or shock or something, versus, okay, this is something that's a little, I can triage, it's, okay, they may have sprained their ankle. That's not going to be a life-threatening condition at this time. So, I mean, you just have to kind of settle down and go with what you know how to do, what you've been trained to do. And having that emergency action plan in place before you have that emergency, like, preparation will make it a whole lot easier when you're actually out there and doing your evaluation, when you're actually out there and having that emergency condition, having that emergency action plan with a protocol that says, these are the steps I'm going to take. Just, like, take a deep breath, settle yourself down, and do what you know how to do.
Okay. Thank you for your time.
You're welcome.